full-time partner in general practice. I have previously been involved in sports medicine. I've run a sports medicine clinic. You may have heard of a club called Sheffield Wednesday. I used to be the club doctor for about 9 years. I've worked for Ford in the World Rally Championship, travelled around the world, so I've seen a few things. One of the things that I know is that Western medicine, as we know it, has been around really for about 60 years. Western pharmaceutical companies are there to make a profit for their shareholders and their investors. And I'm getting fed up of people expecting to get a pill for every ill. Wellness has to come from inside. It has to come from you as an individual, about the choices that you make with regards to what you eat, how healthy you want to be in terms of exercise, but also the choices that you make about the toxins that you put into your body in terms of alcohol, cigarettes, nowadays recreational drugs. To have natural products is your choice to take them. To have natural products that help with the dietary choices that you make has to be of benefit. To have the opportunity to be involved in a company at the cutting edge of producing natural products is a gift for us, and it's one which we should embrace. The biggest problem in this country and in Western society is obesity. Currently in the UK, 30% of the population, about 16, 17 million people, are overweight. In 10 years, that will be 50% of the population. The cost to the NHS is unsustainable, and healthcare in this country will collapse in the next 10 years because of obesity as a problem. That is something I'm passionate about. I had the luck to go to Vienna for the Congress, and I managed to spend a whole of a Saturday afternoon one-to-one talking to Matthew Tripp about his past, the reason that he'd come to Synergy, the great opportunity that he thought the Hughes Centre was, and the research that he was hoping to do. He was very careful, and I will say this because I went into this as a skeptic. Pro-arginine has benefits. It doesn't have all of the benefits that are spoken about. So the legal side of the company are very careful in comments that people make about the products that the company sells. I can understand that. We know what pro-arginine does. We also know what it doesn't do. And there are grey areas, and I would suggest that you don't say it's the panacea for all good, because some of the people that you sell product to and your downline will sell product to will have customers who will still have heart attacks, strokes, develop cancer, become obese, feel sluggish. Be careful of the wording that you use around these products, please. So Terry persuaded me to take microbiome, but it wasn't a very difficult persuasion because I'd sat, as I say, with Matt Tripp and been through his very expansive presentation. But he also gave me access to a number of scientific papers which I've read and which I can forward to you. I'll forward them through Grant. Some of them are far too complex for me to understand, so I'll probably make it the ones that are easier to understand, just so you can understand what research is currently coming out with regards to the microbiome and health in general, but with particular emphasis on obesity, heart disease, diabetes. Because if we can help through our choices with regards to gut health, influence those things, an awful lot of lives are going to be saved, but also huge cost to health systems. I took it. It's a very easy product to take. It compromises Body Prime, which which is the magnesium, which you take for a week beforehand. Then there's a protein shake, chlorophyll-based shake, pro-arginine, obviously, but importantly, you realign your own gut flora with a very specific bacillus, which Matt Tripp has worked on and is available in capsule form. You take 3 capsules a day for a week, and it realigns your own gut flora. It isn't the only thing you do. You also change what you put into your body in terms of diet. And the microbiome pack will explain that. So this isn't a solution on its own. You have to make the correct choices in terms of dietary intake as well. And that's something that Matt Tripp was very specific about. Synergy produces great products. You also have to exercise more, and you also have to make the right food choices. So there's 3 things acting together. I took it, very easy to take. I lost about half a stone in weight in 2 weeks, which I've maintained since then. Because what happened at the end of the microbiome was that I felt more energized. I've gone back to the gym, which is something I hadn't done for about a year. Last year I ran the London Marathon, I cycled London to Paris. I'm a quite a fit person naturally, but I think we all go through phases in our lives when you just knock off your activity level, you feel a bit sluggish, and then that self-perpetuates itself. You put on weight, so you feel like doing less exercise and you become more sluggish. To have a product like this that's available is fantastic. What I want to do, working with Matt, is do some UK-based research. And I would like to get this product into the NHS. I'm looking at a different model to having a downline. My downline, I want to be the NHS. And if we can tackle obesity using products that Synergy is producing, that for me is a massive achievement. I think, Grant, one of the things you mentioned, the board of Synergy. These are people who have worked in global corporations like Disney and Coca-Cola and made the choice to come and work at Synergy. That for me is massive, because if you have that global corporate expertise, they will ensure that this is a successful company. The decision to delay the everyone's personal websites and things, which is coming out, because they wanted Oracle to run that software program, is a mark of the company's global ambition to get it right the first time, rather than release a beta version which fails us all, we get frustrated. They want to do things right. One of the points you made about SLM was that protein-based. I have a lot of patients who have Slim Fast. They try and lose weight on Slim Fast. What happens with that product, because it's cellulose, you lose weight very quickly. As soon as you stop taking it, you gain the weight probably within a month that you lost. This will keep the weight off because it has a different composition. As I said, I've got a few papers which Matt Tripp has sent to me. I will send the more easily understandable ones to you, and it'll give you some background on why the company is focusing on this elite health and the microbiome. It makes absolute sense to me. And I think long term, the development potential within the company is huge. I'm going to a meeting on the 17th and 18th with Matt Tripp. I think they've got a few doctors in Europe who are interested, and they want to form a European medical panel. It would be my privilege to work on that panel with these guys. Because if we can get away from Western pharma and start to concentrate more on wellness, our wellness, through natural products, that to me is a huge step. Okay?
Yeah.
Thank you.